Hello, how are you? Most welcome to my channel. This is Gogi Bruno, and today we are discussing on 𝚘𝙘𝙧 or maybe androgen receptors for women. And probably you've seen ladies who grow beards and then they have a lot of hair growth around the body. So 𝚘𝙘𝙧 is where women are growing beards. Probably they have facial hair that is thickening at the back, around the chest, and this is linked to hormonal 𝚘𝙧 is actually linked to an hormone called androgen, and it can happen at any level, and this increases body in terms of 𝚘𝙘𝙧 is linked to some hormone called androgen, and for women PCOS also could play a part, and we are looking at better ways in which we can control ovaries in terms of production of sensitivity to a lot of body hair. And some causes could be polycystic ovarian syndrome. These are conditions affecting ovaries and may also affect the cause of some of the symptoms like acne, irregular periods. And so some ladies struggle with 𝚘𝙘𝙧, and this also affects androgen, as I had said earlier. And when there is increase in the hormone production or maybe sensitivity to it, then a lady could experience growth of hair, and then could also have symptoms like, as I had said, acne and also irregular. Welcome. So this could be growth of hair in the back, and PCOS actually contributes towards the growth of hair in most women. Periods. So this could be genetics, and this condition may be excessive growth of dark coarse hair. Maybe it could be the face, chest, at the back. And 𝚘𝙘𝙧, the extra hair growth, arises from male hormone, could be androgen, which is the primary testosterone. That most ladies have little production of testosterone, the male hormone, but when it is inherited, could also lead to excessive pigmentation of hair on some areas, and typically grows include the This is a condition where there's excessive growth of hair on the face, and for women this could be disturbing because now it affects the quality of life for some women, and we use this to care for them too. The face, the chest, and the back. So 𝚘𝙘𝙧 can be treated, and actually hair growth can be removed through electrolysis. On top of that, this is to give honor to women and also to help them in terms of preventing growth of hair on the face and taking proactive. Or maybe laser therapy. But our option provides you with, instead of just taking oral contraceptives or maybe birth control pills, or taking contraceptives just to help you balance the estrogen and progestin, 𝚘𝙘𝙧 can be, in terms of looking at the androgen production, some people can take anti-androgens. This could be drugs that block androgen production and attach to the receptors in the body. Some people could use topical creams to prevent this. So these women are born with these hair follicles that are more sensitive to androgens, and my main objective is to help. So when I give you most welcome. 𝙾𝙾 is a brilliant product for controlling 𝚘𝙘𝙧, but also amazing for control of corticosteroids, which is amazing when it comes to addressing the 12 weeks that we are giving you vitamin D. Amazing also in terms of controlling 𝚘𝙘𝙧. 𝙾𝙾, this is a control for an antidote for this. So 𝙾𝙾 contains magnesium and zinc. So patients with 𝚘𝙘𝙧 can also take magnesium inside that food diet that I offer. Has magnesium, has zinc, has calcium, has vitamin D, and these supplements, when taken for about 12 weeks, really decrease facial hair growth. And 𝙾𝙾 controls testosterone levels in androgen production in women, especially in the ovaries. That the testosterone could be in small quantities, but need to be also addressed. So also 𝙾𝙾 also contains vitamin E, which inhibits growth of facial hair, and vitamin E also counters the androgen and reduces testosterone levels in the body. So vitamin E component in the 𝙾𝙾 can regulate production of androgen, which reduces the effect of testosterone in terms of production of body hair. Then also very key and top on my agenda, anytime a lady reaches 40, 𝙾𝙀𝙀 helps control the androgen production, as I had said. But then 𝙾𝙀𝙀 also helps ladies above 40 years old to control their androgen levels in terms of controlling their hormones that is causing the hair growth. So once we give 𝙾𝙀𝙀, we can give it for 2 months, and this is amazing for also helping control the ovaries in terms of adrenal gland production of 40 to 50% of body testosterone. Then prevents tumors. So when you're taking 𝙾𝙀𝙀, also helps you with the ovaries in terms of preventing polycystic ovarian syndrome that can cause too much androgen production. So when there is PCOS, the polycystic ovarian syndrome, you may notice that a lady may be overproducing androgen hormone, which now can affect the hair growth in the body. So also 𝙾𝙀𝙀 is also very useful in the pituitary gland that leads to excessive production of corticosteroids. Now, when this combination of PCOS and affect the quality of life for some ladies, and I like giving 𝙘𝙀𝙧𝙪𝙀𝙀. Welcome. 𝙘𝙀𝙧𝙀𝙪 is brilliant for addressing any need that is in 𝙘𝚘𝚪, especially for controlling vitamin B12 and powerhouse for preventing 𝙘𝚘𝚪, because 𝙘𝙀𝙧 is the lady's best friend for controlling the androgen hormone. And then when you take 𝙘𝙀𝙧, you are reversing facial hairs and controlling biotin, which is responsible for production of hair and nails. Then 𝙘𝙀𝙧 prevents high prolactin levels in women. Prolactin is very key, especially when someone is pregnant or maybe breastfeeding. It's very useful. But when there is high production of that prolactin, you find that 𝙘𝙀𝙧 also corrects excessive growth of dark, maybe coarse hair, and the male pattern growth of hair around the face, chest, and back, and often arises from male hormones, the androgen, which is primarily the testosterone component, that deters the cell growth, especially if a lady needs to prevent the male element in the body. And then you're finding the active component in the product is polysaccharide peptide, which prevent enlarging of the clitoris due to high testosterone level in the body. Some ladies could experience acne around the face when the testosterone levels or maybe are rising. Some may have decreased breast size. Others could have very deep voices and increasing muscle mass, like the male gender do. So when we give you 𝙘𝙀𝙧, what we are doing is that we are controlling the vitamin B component in the body that prevents excessive weight gain, excessive hair growth like 𝙘𝚘𝚪, menstrual dysfunction, and infertility. So this product contains B6, vitamin B6 and vitamin E that gets rid of unwanted hair growth and facial growth around women. So vitamin B6 also lowers testosterone in women and inhibits the prolactin hormone in women. So when we are issuing 𝙘𝙀𝙧, we are doing a lot more than that. Then I also like He is a superfowl called 𝙘𝙀𝙀, brilliant for giving you that proactive nature to take care of your biotin, but also regulating the amount of B12 in your body. 𝙘𝙀𝙀 is a control for prolactin, and amazing for women who wants to have very good hair growth, but also controlling it. 𝙘𝙀𝙀 is a very brilliant product for controlling 𝙘𝚘𝚪 and androgen levels in the body. So 𝙘𝙀𝙀 is a derivative of NMN and also contains resveratrol. Now this is a very powerful antioxidant that you just take 1 pouch per day. So 𝙘𝙀𝙀 is very high, stops very high levels of prolactin levels in women, and high prolactin levels in women interfere with normal production of hormones such as estrogen and progesterone. So when we are giving 𝙘𝙀𝙀, what we are doing is that we are changing anything that would stop proper ovulation, and this could also lead to very good release of egg and maybe the ovary. Then also controls irregular or missed periods. Some women with very high prolactin levels would have other symptoms like hirsutism. That's now what we are doing when we are giving you 𝚘𝚘. Now 𝚘𝚘 also is amazing for guiding facial hair and controlling, promoting hair growth, but also regulating the same. So daily intake of 𝚘𝚘 regulates biotin, which is responsible for placement of hair growth in the body, then also prevents developing of beards around women. It's an amazing product for controlling biotin, which is responsible at the rate at which hair growth is happening in the body. Then also it's incubated vitamin B protein in your diet that regulates also the prolactin hormone production in your body. And actually this is a very proactive way in ensuring that facial hair can also fall off and also control its growth. Okay. Then I give you most welcome. The 𝚑𝚘𝚑 is brilliant for reversing hirsutism and setting up your endocrine gland. Amazing for balancing your hormones and for controlling hormones. Brilliant for preventing hirsutism. So this is grapeseed extracts and regulates body hormones in terms of chemical messengers that you're having in the body. Amazing. 𝚑𝚑𝚑, it also helps with the endocrine glands and production of chemicals in the body to travel the bloodstream, making sure that the tissues are taken care of and also very good for hormone production. So when we issue 𝚑𝚑𝚑, what we're doing is that we're influencing body's processes, including the metabolism. So 𝚑𝚑𝚑 here also controls polycystic ovarian syndromes, which is the main cause of hirsutism. Now 𝚑𝚑𝚑 boosts also the hormonal balance for the body, especially the androgen and sensitivity to estrogen, progesterone, and gonadotropin. So these hormones are responsible for a woman's body and also helping the person to adjust to the changes that are happening in the body. 𝚑𝚑𝚑 prevents androgen hormone from production and overproduction of the same. This prevents a lot of hair production on the upper lip. You've seen ladies with hair around the lip, upper lip. Then they could have hair around the chest or maybe at the back. And this could be genetics running through the family. So emotional stress like PCOS could also affect the ovaries and cause acne and irregular periods. So that's it for today. I was just sharing for 10 minutes. So that's the range of solutions we provide for ladies. So until next time, I'll be providing another video tomorrow on health of women and probably giving you another shot on how best you can take care of your body to prevent aging and premature aging. Until next time, thank you.